Tonight.
I'd have, like, instead of just having a sandwich at lunch, I'd have 2 or 3, and I'd snack all day. The highest I got to was 440.
I didn't know that he was that heavy. I was shocked.
An ABC 27 special presentation.
I think I lost 15 pounds in the first week before my surgery, so I was already really excited.
The Wait is Over, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. It's a new year with new resolutions. Losing weight may be one of them. Many people struggle with their weight. In fact, obesity is a growing epidemic. Statistics show 1 in 3 Americans of all ages are obese. And obesity is the cause of a number of health issues, including high blood pressure and type 2 diabetes, among others. So what are your options if you really want to lose weight but can't? How do you qualify for bariatric surgery? How successful is the surgery? We will answer those questions for you tonight. And if you have questions at home, Amy Kem is here to tell you how to get them answered. Hi, Amy.
Hi, Deborah. Well, specialists from Penn State Health are here in the ABC 27 call center right now. They'll be here until 8 o'clock tonight answering your questions. Feel free to give them a call at the number you see on your screen. You also can email questions to us at questions@abc27.com. Bariatric nurse practitioner Eileen Feely will answer your emails throughout tonight's show. Of course, all emails and calls are confidential, and I'll be back later in the show to share some of those questions with you. Back to you.
Thanks, Amy. A Perry County man never expected to be told he needed to lose weight if he wanted to live a normal life. That was the case for Evan Snyder. Here's his journey. 27-year-old Evan Snyder has been a part of Wonder Why Farm since he was born.
I'm the 5th generation to be here, so this place has been around for a while in our family.
The legacy lives on with Evan. Now he helps run the farm.
I take care of the animals. We have 20,000 turkeys and 5,000 pigs and a few hundred head of steers and like 100 goats and lambs. So pretty much just making sure everything's running smoothly and everything's good.
Evan had to take months off because he was very sick.
I started to feel bad on a Sunday, and I thought I had a kidney stone, and I just kind of downplayed it. And then on a Thursday morning, I finally went to the hospital.
He came to us because he had had a terrible bout of diverticulitis, which is an inflammation of the colon. And his was so bad that he actually perforated a hole in his colon and had peritonitis and was just very, very sick.
He was essentially in septic shock as a result of the perforated diverticulitis. He was in renal failure and required dialysis. He had actually had a cardiac arrest and had undergone CPR.
And he actually ended up with an end colostomy, a colostomy bag, because of the surgery.
It was really scary. And we didn't know what was going to be next.
I was in a coma for 7 or 8 days, and then I was in the ICU for another 6. I had to go to a rehab for a few weeks also to get back on my feet because I was flat on my back for a while. I couldn't even really walk.
When he finally got better, he also had a hernia in his midline wound from that operation.
And then I went back to the doctor in the fall of 2017, hoping to get the news that I would have my hernia repaired and my colostomy reversed.
I spent that first clinic visit talking with him about not the hernia, but talking about getting his weight down, getting his ostomy reversed, and then talking about how we would address the hernia during the course of one of those 2 operations.
Dr. Paul, I said, well, you need to lose weight. He says you need to be under 300 pounds, or it was a BMI of 40.
Weight was always a challenge for Evan.
I never really ate like bad things. I just ate way too much of everything else. You know, I'd have, like, instead of just having a sandwich at lunch, I'd have 2 or 3, and I'd snack all day.
I thought he looked good when he graduated. But now when I look at him, I'm like, oh my word, he was just really, really overweight.
I would try different diets, you know, the ones you see on TV. They say, you know, lose 25 pounds or lose 50 pounds fast. And if I'd try it for a week and I'd either get tired of it and just give up, or if I didn't see the results I was looking for, I'd just give up.
Probably twice a year I think he had to get bigger clothing. So that was hard, and it was hard for him because he couldn't shop where other people shop.
The highest I got to was 440 back in January 2017.
I didn't know that he was that heavy. until I seen, when he was in the hospital, I saw the number and I was shocked.
Now Evan had to make some life-changing choices.
Dr. Pauli came to me with a pamphlet with Dr. Rogers on the front of it, saying that I should make an appointment with her and see what she has to say about it.
Evan enrolled in the Penn State Health surgical weight loss program immediately.
He had a pretty typical 6-month program with us, with education, with the dietitians, and with behavioral health, psychological testing and evaluation.
She said I needed to take their classes to pretty much learn about how to take care of my weight loss.
We try to give them the education that they'll need so that they'll know how to eat safely after they have the operation.
I mean, pretty much changing everything I do. I mean, we're farmers, so we eat a lot of meat, we eat a lot of protein, but you don't have to have 2 or 3 hamburgers. You can just have a small portion and still get plenty of nutrition out of it.
He was excited about it. I mean, he really was. It was like almost a countdown to getting this done.
The week before my surgery, you only have liquids, and I think I lost 15 pounds in the first week before my surgery. So I was already really excited.
He had the sleeve gastrectomy, which is the most common operation for weight in the world. With the sleeve gastrectomy, we remove about 70% of the outer stretchy part of the stomach. A patient is left with their own tube of normal stomach, but it's not stretchy at all. It doesn't have much give. So it's a smaller stomach than ordinarily they would have. It also removes a lot of the cells that create ghrelin, the hunger hormone. So sleeve gastrectomy patients tend not to have so much hunger all the time.
In March, when I got my surgery, until the end of April, so like a month later, I think I lost like 40 pounds. So it was an awesome feeling knowing that it was starting to work already and that things were headed in the right direction.
The weight continued to drop.
I had another appointment in August of 2018 with Dr. Pauli, and I went and I weighed 275 pounds. And I had to be under 295 because he wanted my BMI under 40. And I had made it by over 20 pounds. So I was ecstatic, and I think he was too.
We did, for our hernia center, a relatively straightforward operation called a component separation, where we take the layers of the abdominal wall and we separate them, and we put a layer of the patient back together, and then a big piece of mesh to reinforce, and then we close the muscles back together. He went to the operating room with an ostomy bag and a big hernia, and he woke up with neither of those things.
A life-changing operation for Evan.
I can't believe I've lost almost another 80 pounds since then. I kind of thought I would slow up, but I steadily have lost in the year past since then, and now I'm down to 195. This is the barn coat I used to wear before I made the transformation. It's a size 6X, and I used to wear a size 52 pants, and I'm now down to extra large sweatshirt and size 32 pants.
I just think he thinks that he can take the world on, and I mean, he can. You know, that's, as a parent, you always want your kids to think that, but now he knows he can.
I'm happier, I feel better. I think people enjoy being around me a little more because I'm not always tired and worried about food. I can go out and enjoy myself and do so many things that were never possible only a few years ago. I feel awesome. I feel like a whole entirely different person now.
And as you could see, Evan is doing really well. He had 5 garbage bags full of oversized clothing, and he donated them to a nursing home in Cumberland County. Just a really nice guy with a great result. Joining us now is Dr. Ann Rogers, Director of the Surgical Weight Loss Program at Penn State. Really, what a remarkable result for Evan.
He had a great result.
Who is an ideal candidate?
You'd be amazed, 5% of human beings qualify for bariatric surgery. That's millions of people. So there are many people wandering around who don't even realize that they have this health problem.
And what type of BMI do they need to have in order to qualify?
So BMI is a calculation of height and weight. And in the United States, if you have a BMI of 40 or 35 with some severe health problem, you potentially qualify for bariatric surgery.
And if you would like to have bariatric surgery, what are the options?
We offer the conventional procedures, which are the gastric bypass, the sleeve gastrectomy that Evan had, and we also offer the duodenal switch procedure, which is much less common. It's a very complicated operation.
And what is the most popular, and how has it changed?
So the sleeve has been the most common operation for weight since about 2013. Prior to that, we were doing more gastric bypasses.
And you do a lot of prep before the actual surgery happens. How is it after you have the surgery?
Well, patients have programmed visits going out to 5 years, and really studies have shown that those patients who come for their follow-up are more likely to be successful.
And monthly meetings as well?
We have support groups for patients. Some of them are post-op, some are pre-op, and they like to get the backstory from other people who've gone through it.
And what really makes your program unique?
So we have a national accreditation, first of all. That's hard to get and it's hard to maintain. We're also completely self-contained, so we have our own dietitians, our own psychologist. We don't farm anything out to outside providers, and we now have our own medical bariatrician, so she'll be able to help our patients with things like appetite suppressants.
And we're looking at some of the pictures of before and after, and really remarkable.
It's amazing.
And it's just a matter of sticking with the program, sticking to the diets, and listening to the dietitians.
Exactly.
Okay, Dr. Rogers, thanks for being here. We are going to talk to you a little bit later in the show. And if you would like to make an appointment with the surgical weight loss team at Penn State Health, this is the number to call, 866-695-7602. Let's check in with Amy Kemen, the ABC 27 call center. Amy?
Deborah, the phone lines definitely have been busy this evening. You at home can give us a call at 717-346-3333. Here to answer our viewer questions tonight, we welcome Dr. Randy Hellick. He is the Chief of Minimally Invasive and Bariatric Surgery at Penn State Health. Here's our first viewer question this evening. I'm 30 years old. I'm the heaviest I've ever been. I weigh 285 pounds. How much do I need to weigh in order to qualify for surgery?
Well, rather than just going by pure weight, the criteria that we use, most physicians use, and insurance uses for criteria for weight loss surgery is known as body mass index. And it's a calculation of weight versus height. So somebody who's taller obviously would weigh more than somebody who's shorter. And patients can find that online. There's calculators for body mass index. And we also work with you in the program to calculate that. But the magic number is a body mass index of 40. A female that weighs 285 pounds of normal height would have a body mass index in excess of 40 and would qualify for weight loss surgery.
Okay, thank you. Great information. Thank you, Dr. Hellick. If you have a question for a specialist, you can call the number you've been seeing on your screen. You also can email your questions. You can send them to questions@abc27.com. Stay with us. We'll be right back.
You're watching The Wait is Over on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. Eric Pauli, Director of Endoscopic Surgery. Thank you for being here. Now, Evan needed your help, but you couldn't help him until he actually met with Dr. Rogers. Why is that the case, and how often does it happen?
In my practice, it happens very commonly. I fix a lot of hernias, and hernias are associated with obesity. And when I meet a patient who has those two things together, we talk about getting them medically optimized for a hernia repair to give them a better outcome. And for many patients, a surgical weight loss procedure is part of that process.
So you gave him the direction, and he met with Dr. Rogers. He had the surgery, lost weight, did everything that you said, then he made the appointment with you. How did it make a difference in the surgery?
It made a world of difference. He had essentially two complex problems. He needed his ostomy taken down and a complex hernia repair. And neither of those things would have been possible with him at the weight that he was when we met him. And so his operation was entirely because of his weight loss.
And he really does look amazing.
He looks and feels great, and he's busy and active on the farm, which I think is a testament to the quality of the repair that he ultimately got.
Now, he gave you something
He did.
that you use often?
He gave me a t-shirt from the farm, and I wear blue every Wednesday when I operate, so this is my Wednesday operating t-shirt from Evans Farm.
A nice reminder
Yeah.
of the things you did. Now, once people have had surgery, what can they look for if, say, something isn't going right? Are there things that they should look out for?
Yeah, there's a variety of different signs and things that we ask them to look out for. It depends a little on what operation they got. Part of the entire process of going through the weight loss program is not just learning about before the surgery, but learning about what to look for after the surgery. Typical symptoms, nausea, vomiting, reflux, excessive weight loss are all things we ask them to call back for.
And the team is accessible. You just need to give them a call and someone's there to help.
Absolutely, and they always have a yearly visit scheduled, so they know there's a calendar date when they're going to be seen in between anyway.
Sometimes people have surgery and they gain the weight back, and I'm sure that's very frustrating. What are their options?
Well, there's a variety of options. Weight gain after one of these operations is from a variety of reasons. Some of them are dietary, and so getting folks back in with our dietary program is important. But some patients have surgical problems afterwards that can be corrected with an endoscopic procedure, and part of our program involves us thoroughly evaluating patients who've regained weight to see if they're a candidate for a revisional operation or an endoscopy to help.
Okay, what is that operation called and how does it work?
Yeah, it's called application, and it's a procedure that we do by passing a camera down through the mouth and into the stomach, and I actually have a small sewing machine that I use to revise the operation from the inside.
And who gets the best results from having this done?
Yeah, the best results from plications happen in patients who have lost their sense of fullness after meals. They find they can eat more than they could before. They may have a pouch that's enlarged over the course of time or an intestinal connection that's slightly larger than it should be, and they get very good results.
Okay, Dr. Paulai, lots of really good information. Thank you for being with us. And if you would like to make an appointment with the surgical weight loss team at Penn State Health, this is the number to call, 866-695-7602. Let's go back to the ABC 27 call center. How's it going, Amy?
It is busy, very, very busy here in the call center. And folks at home, you still have a few moments to get those questions in. Again, that number is 717-346-3333. The phone lines will stay open until 8 this evening. We're going to get some more questions now. My family doctor suggested I have surgical weight loss surgery. I'm worried about extra skin after weight loss. What are my options?
Excess skin can be a consequence of rapid weight loss and massive weight loss. It really varies by the individual. Sometimes just good old-fashioned exercise and building a muscle will help with that and tone. When that isn't sufficient, we work in conjunction with our plastic surgeons at Penn State Health, and sometimes excess skin removal or body contouring is appropriate.
Very good. And here's a question about post-surgery.
Sure.
How important is diet after surgical weight loss surgery? Will I have restrictions on the foods that I can eat?
Diet is very important after weight loss surgery, and we do all this to provide patients with a tool so that they can adopt a healthy lifestyle, including a healthy diet. And there really aren't restrictions on food, but we want people to be making good food choices and healthy food choices.
Okay, and I have one more for you. This is, I had surgical weight loss surgery 10 years ago. I regained more than 100 pounds. I've tried to lose the weight. It's not working. Since it's been so long, could a dietitian help?
Yes, unfortunately, weight regain does happen after weight loss surgery. It's not common, but it can happen. And yes, that's one of our first steps in evaluating patients that have regained weight is an evaluation with a dietitian to see if those healthy food choices, are in fact happening. Absolutely.
Very good. Thank you for all your answers tonight, Dr. Howlick. And thanks to the specialists here from Penn State Health who have been here answering those viewer questions. We're going to send it back to Deborah.
Thank you, Amy. Welcome back. Joining us is Dr. Ann Rogers and her patient, Brandon Zinn. Thank you for being here with us tonight.
Absolutely.
Brandon, why don't you talk to us about what your situation was?
I just grew up, very, very heavy. I remember back to 12, 13 years old, I remember my weight just starting to go up and increase. And as the heavier I got, the more sad I got, and it just kept piling on.
And what did you try?
I tried everything under the sun, all the TV fad diets, the juices, the cleanses, and all the other detoxes and stuff like that, all the famous diets as well. Low carb, high protein, just never seemed to work out for me. I didn't meet my goal and got discouraged and just quit.
So did you gain weight, you lost weight, then you would gain it back,
Yep.
type of thing?
Yeah, several years of I'm doing this, I'm going to the gym, I'm working out, I'm eating healthy, I didn't lose the weight I wanted to lose, so why keep going? And then I would just, gain 20, 30, 40 pounds back each time.
Very frustrating.
Very.
So 2 years ago, you registered with the Penn State Surgical Weight Loss Team at Penn State Health, and that's where you met Dr. Rogers. Dr. Rogers, what was your suggestion?
So when we met, we discussed his lifestyle issues, his health issues, and we agreed that he would undergo the sleeve gastrectomy.
And you mentioned that is the most popular.
Correct.
Popular surgery. Brandon, what was your reaction when she said, yeah, you qualify for this?
It was kind of disheartening because I know that I was going through the process and I was looking into surgical weight loss, but it was also almost a gut punch. It was this final realization that I really had a problem and an addiction to food, and it was just really tough to hear. But at the same time, it was kind of heartwarming to know that there was hope at the end of all this.
And any fears about undergoing this type of surgery?
All the normal fears I think probably every patient has. If not, what would happen to me? Am I going to be successful? Like I'm, getting half of my stomach cut out. What if this doesn't work? What if I just get back to it and all that? And psychology and nutrition, and Dr. Rogers really helped out with that.
And how important is support from other people? Did you have support?
Yeah, 100%. I had the whole support of my family and my main circle of friends. I had started to talk to about it at people at the nonprofit that I volunteered for, and even at work. And just having that support and knowing that once I got out of surgery and I got back to work and started living my life again, that everybody was going to be accepting of the lifestyle change, and it was no more 24 wings at a time type situations.
And Dr. Rogers, how did the surgery go? What about time? How long does it take? How much time do you spend in the hospital?
So the surgery itself takes about an hour. It's a relatively quick and painless, you got to sleep through it, operation.
That's a good thing.
And most people go home the next day. So, and they're eating when they go home. So the recovery time is mostly getting in the protein and the liquids that you need.
And talk to me about the results after surgery.
I mean, they speak for themselves.
You look great.
Thank you. I was about 335 pounds when this whole process started, and that was the heaviest that I had ever been. And I, just enjoy looking in the mirror now, whereas before it would, I would shy away. And you guys were looking for pictures, and I was like, well, I was standing behind everybody all the time. So I'm just more out, more open, more outgoing. And I think I'm all around just a happier person now that, I've lost the weight and I feel comfortable with who I am.
And how is it as far as going to restaurants and eating food and, what's always going through your mind?
There's always that oh, this looks good, or I can do the small steak if I'm in the mood for that. There's also sometimes like a fear of judgment if I have to say oh, I had weight loss surgery. Can I order off the kids menu just to, so I'm still getting my nutrition, just not eating like I was before. But most people have been pretty accepting of it.
I know when we talk to patients, clothing, where they buy their clothes changes dramatically.
Absolutely. I was just sharing a story earlier with Dr. Rogers, and I would make a comment about the size clothing that I wore before, and I was shopping recently, and I was very proud to say, oh, yep, I date a size 36 jeans now. And so it's been really, really cool to, get out and go shopping and hang out with my friends and do things like that. I mean, just shopping, like going to amusement parks, so, I can ride rides now and just be all around happy being healthy.
And what was the biggest challenge, or what is the biggest challenge every day now for you?
Making sure that I do not fall back into those bad habits. Like I said earlier, I would order a huge meal. I would, get the appetizer sampler at a local restaurant for my meal and then eat a few more wings or a burger after that. So just changing the way I look at food, whereas it's not so much, oh, you're my best friend and you're helping me. Now it's, I need you to live, but I don't need you that much anymore.
And Dr. Rogers, you've performed this surgery for numerous years. What is the typical amount of weight loss? Brandon looks great.
Yep. I would say on average people can expect to lose about a third of their weight, starting from whatever was their highest weight. That's pretty typical. Some people go farther.
And also, someone's sitting at home and they're thinking, maybe this is something I should do. We're looking at pictures of before and after, and once again, these are great pictures. Someone saying, maybe I should do something like this, but I'm not sure. What is your advice to them?
I would have people just come to one of our free information seminars and hear what we have to say, talk to the surgeon, ask your questions. Most people end up after our seminar really happy and pleased with what they've heard and wanting to get started as quickly as possible.
And Brenda, what advice would you give people who are considering this?
Just go for it. Go to an information session, do some research on your own online like I did. It's a mindset change, and from top to bottom you really have to make the commitment to yourself to make that change.
And that is true. That's what I've heard too over the years of doing these, talking to you and interviewing patients, that it is really a mindset change. This is just a tool to get you to where you need to be, but what a tool it is though.
Absolutely. It's a tool that saved my life.
Right. And you find that's really the case with people as well. I mean, people need to lose the weight because it is a health-related issue.
Yep. It's not cosmetic. This is really a health thing.
Okay, great. Lots of really good information from you.
Thank
Brandon, thank you so much for being here and joining us this evening. We also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information or if you would like to schedule an appointment with Penn State Health, this is the number to call, 866-695-7602. Once again, that number is 866-695-7602. Or you can visit online at hmc.pennstatehealth.org/SWL. We want to thank you for watching. Lots of really good information tonight. We wish you good health.